Okay, let's be real. Have you ever walked out of a doctor's office just completely frustrated? You know something is off with your hormones, but you've just been told that everything's fine. Well, today, we're going to pull back the curtain on hormone testing and get into why normal doesn't always mean optimal. Let's dive in.
It's a story so many of us know, right? You've got all the symptoms. You're tired, you've got brain fog, the mood swings are real, you name it. But then your blood work comes back with that one single frustrating word, normal. And you're just left there feeling totally dismissed, maybe even like you're making it all up.
But here's what I want you to hear loud and clear. That gut feeling, it's not wrong. That disconnect you feel between your actual lived experience and what's on that lab report, it is not in your head. It is a real, shared problem, and it points to a massive gap in how we usually look at our hormonal health.
So, what's the deal? Why the huge disconnect? Let's totally unpack this normal lab myth. The answer, believe it or not, starts with some really basic, but for some reason widely underappreciated biology.
Okay, so the whole problem really boils down to this one super simple fact. Sex hormones, we're talking estrogen, progesterone, testosterone, they're fat-soluble. They are literally made from cholesterol. And this one little detail changes absolutely everything about how we should be measuring them.
And that right there is the perfect analogy. Think about it. Your bloodstream is what, like 90% water? So trying to get a clear picture of your fat-based hormones by only looking at them in a water-based environment, well, it's just like trying to measure oil in a glass of water. They don't mix. You're just not going to see the whole story.
All right, so how do we actually crack this code? Let's get into the science behind the numbers because we need to see what those standard tests are missing, and more importantly, what we should be looking at instead. Okay, here's the key word you need to know: bioavailable. Think of it like this. Most of the hormones in your body are kind of stuck, bound to these carrier proteins. They're like riding around in a taxi. But here's the catch. They can't actually do their job until they get out of the taxi. So it's only that small, free amount that's unbound and actually bioavailable, the ones that can get to your cells and make things happen. So let's break down exactly where the standard tests go wrong. Your body makes the hormones. Check. Then these carrier proteins glom onto most of them. But remember, only the free ones are doing the work. Now here's the kicker. Your standard blood test, it measures the total amount, the ones in the taxi and the ones that are free. And this can give you a normal number on paper, even if the amount of active, usable hormone is actually in the basement. That gap, right there, that is where all your symptoms are living. And this is exactly why a different approach is needed. It's why many forward-thinking practitioners use specialty testing, like the Dutch test. A standard test, it just gives you that total number, which can be really misleading. But specialty testing, that shows you the free bioavailable hormones. It could even show you how your body is breaking them down and getting rid of them. It's really the difference between a blurry, out-of-focus snapshot and a full-on, high-definition movie of what's happening inside your body.
So all of this leads to a totally different way of thinking about healthcare, one that treats balancing your hormones as both an art and a science.
And Dr. Laura Neville just puts it perfectly here. It's not just about ordering the right fancy test. It's about combining that hard, objective data with your own story, your own experience to actually see the full picture.
You see, it's about treating this like two sides of the same coin. The science part, that's the objective data you get from those advanced tests. But the art, well, the art is valuing your subjective experience, your symptoms, your story as equally important clinical data. One really isn't complete without the other.
And this is huge. This is so empowering. It means that your fatigue, your brain fog, your achy joints, they aren't just complaints to be brushed aside. No way. They are vital clues. They're crucial data points that help guide the entire investigation. You are the expert on your own body. Okay, let's switch gears and talk about the hormone at the heart of all this, estrogen. I mean, for years, it has been painted as this big, scary villain, but it's time we set the record straight. For decades, really since a big study back in 2002, this wave of fear just washed over everything related to hormone therapy, and estrogen got this terrible reputation. But the real truth? Estrogen is an absolute rock star. It is an indispensable, multitasking superstar that plays a vital role in hundreds, literally hundreds of functions in your body. So what is its real job description? Well, for starters, it helps regulate your body temperature. This is exactly why, when levels start to drop during perimenopause, you get those infamous hot flashes and night sweats. It's your internal thermostat going haywire. Next up, your joints. Estrogen actually has an anti-inflammatory effect in our connective tissues. So that new achiness, that stiffness so many women start to feel, yep, it's often a sign that estrogen is on the decline.
And hey, it's also why our skin stays hydrated and elastic. It's a huge driver for collagen production. So having healthy estrogen levels is one of the biggest keys to healthy, vibrant skin.
And this one is so important. It's a huge protector for your brain. It plays a massive role in our cognitive function, in our memory, and even helps us get restful sleep. That brain fog and insomnia a lot of women experience, directly linked to this.
And last, but definitely not least, we've got two of its biggest, most critical long-term jobs: protecting our heart and our entire cardiovascular system, and building and maintaining strong bones. The loss of estrogen after menopause is directly linked to a higher risk for both heart disease and osteoporosis. See, it's not a villain, it's a protector.
Look, all of this new understanding is creating a massive shift. It's fueling a whole new era for patients, one that's really defined by the power of self-advocacy. We are more informed than ever, and we're just not as willing to be dismissed anymore. And that is an incredible positive change.
And really, this quote from Dr. Neville just says it all. It's about demanding better care. It's about feeling heard and supported. And it's about finally understanding that you do not have to just power through these debilitating symptoms. You just don't.
So I want to leave you with this final thought. We spend so much time and energy chasing numbers on a lab report, trying to find that one result that's out of range. But what if the most important piece of data has been right there with you the entire time? What if the most important lab result is simply how you feel?
I stopped trying to find a doctor who would listen, and I did this instead. For years, I was doing everything right. Eating clean, exercising, getting 8 hours of sleep, but I was still exhausted. I had constant brain fog, and my hormones felt completely out of whack. Every doctor told me my labs were normal, and it was probably just stress. I was about to give up until I found Holistic Health. It's a free AI wellness tool trained by functional medicine experts. I spent 5 minutes answering questions about everything: my symptoms, my sleep, my digestion, and it built me this. And this was the light bulb moment. It didn't just give me a list of problems, it connected the dots. It showed me how my gut health was likely impacting my hormones and how that was causing the fatigue and the brain fog. It even gave me a clear list of potential root causes, supplements to research, and even the specific lab tests to ask for. Its tip is secure. Over 77,000 people have used it, and it's 100% free to get your blueprint. If you feel like you're not being heard, start here. Understand your body first and then decide your next step.